Hi there. I'm going to take a few minutes to make a plea to all mental health professionals and future mental health professionals like myself to rule out bipolar disorder before diagnosing a depressed client with depression alone. There are many reasons why this is imperative to the wellness of our clients and how missing a bipolar diagnosis can be detrimental to their, lives and the success of their treatment plan. So, bipolar disorder is a serious but treatable mental illness that can affect every aspect of a person's life. In a nutshell, people with bipolar disorder struggle with feeling like they're on a roller coaster of emotional states where they may experience dramatic mood and energy shifts from severe depression to an extreme manic state and all the other states in between. According to the American Psychology Association, bipolar disorder affects 2.6% of American adults, with the first signs and symptoms typically appearing in their teen or early adult years, but it can happen, before and after that. Although bipolar patients do experience depressive states, medicating them for depression alone can lead to years of suffering. The thing you need to understand about bipolar disorder and why it might be misdiagnosed as depression is that there are different types of bipolar disorder, and they vary in extremes. Bipolar 1 is the poster child description, with the severe and dramatic mood shifts that can last varying amounts of time. Another type is called mixed features because symptoms from the manic episodes and depressive episodes may be mixed instead of completely separate, in their own episodes. Bipolar 2 is much less dramatic and the hypomania may not be as extreme. However, the depressive episodes may look very much like typical depression. Cyclothymia is also a type that is much milder than bipolar 1, with unpredictable fluctuations between mild depression and hypomania. So these milder forms of bipolar may be where a lot of misdiagnosis happens, or many of these clients they don't seek diagnosis or help in the first place. Unfortunately, many of these bipolar patients are treated for depression, and antidepressants come, with a risk of triggering or worsening mania symptoms in this group of already vulnerable people. Antidepressants are not designed to improve or lessen fluctuations in mood. So even if the antidepressant didn't cause harm necessarily, it's not likely to be helping the main issue of bipolar. These fluctuations affect more than a person's mood. They can cause a lot of instability in the person's life and in the relationships they have with others. Others who are often confused about how to deal with these dramatic and frequent mood swings. So, untreated bipolar patients are also more likely to engage in substance abuse as a form of self medication than those who are getting treatment. The APA gives us a simple list of signs and symptoms to look for, broken into typical manic state symptoms and then the depressive state symptoms. When a patient is manic, they feel extremely happy. They talk faster than what is thought to be normal. They may feel agitated, irritable, and restless. They're often overconfident, especially in their abilities, and they frequently behave impulsively during this time. They may not be able to sleep, whether from excess energy or racing thoughts. They might even engage in high risk behaviors such as gambling, reckless driving, or excessive spending. A mental health professional is likely to see these clients when they are in a depressive state because when they are manic, they may feel so good and alive that they often don't feel the need for help. So, the following symptoms is what you would see in a client in a depressive state of bipolar. They'll feel sad and hopeless. They'll feel irritable and negative. They're likely to have, low self-esteem and low image of themselves. They may abandon favorite activities, and they may have trouble concentrating and remembering things. They almost always have like some trouble with sleeping, whether getting to sleep or sleeping too much. Most concerning is that they may think a lot about death and even contemplate suicide. So, the good news, though, is that if identified and treated correctly, bipolar patients can lead rewarding and happy lives. But it begins with, the right treatment plan, whether it involves medication, psychotherapy, or both. Medical professionals may avoid bipolar diagnosis in favor of depression because bipolar can be more of a shock to clients and the family than if they were diagnosed with depression. But letting the client know that there is hope and that there is help increases the success of a client's care much more than if they are misdiagnosed. So I'm April Shadowski, and I hope this helps.